White House Press Secretary Karoline Leavitt defended the Donald Trump administration's decision to approve a generic version of the abortion pill mifepristone, amid a growing revolt from Republican lawmakers. News.com has learned that the Food and Drug Administration, FDA, announced its approval, setting off sharp criticism from conservatives who say the move contradicts President Donald Trump's anti-abortion platform. Senator Josh Hawley, RMO, led the charge against the FDA's decision, accusing the agency of endangering women and undermining pro-life commitments. This is shocking. FDA has just approved another chemical abortion drug, when the evidence shows chemical abortion drugs are dangerous and even deadly for the mother. And of course 100% lethal to the child, Hawley wrote on X. He went on to say that the agency failed to keep its word on reviewing the safety of abortion medications. FDA had promised to do a top-to-bottom safety review of the chemical abortion drug, but instead they've just greenlighted new versions of it for distribution. I have lost confidence in the leadership at FDA, he added. Pressed by reporters during a press briefing about the uproar, Leavitt insisted that the FDA's decision was a matter of legal obligation, not political endorsement. The Secretary of Health and Human Services, Robert F. Kennedy Jr., has put out several statements on this, she said. The HHS's decision is not an endorsement of this drug by any means. They are simply following the law. Leavitt cited the HHS statement outlining the statutory requirement governing generic drug approvals. By law, the Secretary of Health and Human Services must approve a generic drug application if the application demonstrates the generic drug is the quote, same, as the brand name drug, she said. Generic applicants are not required to submit independent evidence proving safety and effectiveness. The HHS statement further noted that the FDA's decision does not address the merits of the current safety program, and that the department is reviewing reported side effects to ensure regulatory protections remain sufficient. Leavitt closed by reiterating that the administration's actions were consistent with legal requirements. So, FDA and HHS are following the law. Again, it's not an endorsement of the drug itself, she said. As internal divisions within the Republican Party widen, the White House appears focused on portraying the approval as a procedural matter, and not a political statement on abortion policy.